According to the research work done by Sisira Siribhadra and Sarath Lekampasam in 2014 in Sri Lanka, the median age, which was 25 in the year 1991, is expected to rise to 45 by the year 2041, and half of the population will be over 45 years and vulnerable to osteoporosis. We describe two large epidemiological studies done in Sri Lanka. The first one, called Prospective Osteoporosis Survey, in its initial phase recruited 350 women randomly from the current voters register. 42.4% of women in the entire sample and 61.5% of women over 50 years were found to have osteoporosis. Another study by Arjan Lionel Karunanayake, Mohita Janani Pindya Patilke and Ananda Rajita Vikramasinghe revealed that the population aged 35 to 64 years residing in 22 Grama Niladhari divisions, the smallest administrative units in the country of the Medical Office of Health Area Ragama, Sri Lanka, was identified using the electoral list and stratified into three age groups. A random sample was obtained from each stratum and selected individuals were invited to participate in the study. Their conclusions were female sex, age, BMI, smoking, and level of education were significant predictors of osteoporosis. The prevalence of osteoporosis increased in both women and men after the age of 50. How do you define osteoporosis? Osteo means bone and porosis means porous or full of holes. When you are young and active, the bones are strong due to its structure and mineral content including calcium. Bone contains 99% of the calcium in the body. The mechanical strength of bone is proportional to its mineral content. The Food and Nutrition Board of the U.S. National Academy of Science has recommended 1,000 to 1,300 milligrams of calcium daily for adults and 700 to 1,300 milligrams for children. In osteoporosis, you lose bone, including the minerals, faster than you make it. When you are young, your spine is straight, and as you grow old, the neck bones and the chest spine bones seem to lose their minerals and change the posture by bending the neck and chest spine, referred to as kyphosis. Fractures tend to heal slowly in people who have osteoporosis and may lead to deformities such as curvature of the spine. In long bones, such as the bones of the arms and legs, the fracture usually occurs at the ends of the bones rather than in the middle. Osteoporosis in the bones is a slowly growing process like your high blood pressure, and you have no early symptoms until one day you slip in the bathroom and fracture the neck of the femur bone in one hip. Now, prevention of osteoporosis. Prevention of osteoporosis is generally more successful than treatment because it is easier to prevent loss of bone density than to restore density once it has been lost. Prevention measures are recommended for anyone who has bone loss or who has risk factors for bone loss, regardless of whether they have had osteoporosis related fractures. Osteoporosis prevention involves managing risk factors such as, for example, quitting smoking and avoiding excess alcohol, consuming adequate amounts of calcium and vitamin D, Engaging in weight-bearing exercise such as walking, climbing stairs, or weight training. Taking certain drugs for some people who already have mild bone loss, osteopenia. What are the causes of osteoporosis? Estrogen in the female hormone helps to build and protect bones in women. When the level goes down with age, you lose bone. You also lose bone during and after menopause when your ovaries stop making estrogen. Your risk of getting osteoporosis goes up if you didn't build enough bone as a child from an eating disorder, lack of vitamin D or calcium, or lack of exercise or another health problem. Sports activities for children is essential to prevent osteoporosis later in life. Other risk factors, as sex hormones, testosterone and estrogen go down in both men and women with age, risk goes up. Some cancer treatments also lower these hormones. Too much thyroid hormone or an overactive parathyroid or adrenal gland can bump up your risk, as can other conditions like celiac, kidney or liver disease, lupus, inflammatory bowel disease and rheumatoid arthritis. Steroids like prednisone can also increase your risk. There's a link between thyroid disease and osteoporosis. Thyroid hormones are essential for normal skeletal development and normal bone metabolism in adults and can have detrimental effects due to thyroid dysfunction. Thyroid hormone affects the rate of bone replacement. Too much thyroid hormone, that is thyroxine, in your body speeds the rate at which bone is lost. If this happens too fast, the osteoblasts may not be able to replace the bone lost quickly enough. Osteoblasts are cells that build bone. In short, thyroid hormone accelerates the turnover of bone, especially the osteoclastic activity. Hypothyroid or low thyroid gland production of thyroxine does not seem to lead to bone loss. So it is important to check on your thyroid function if you get osteoporosis. Increased parathyroid gland or adrenal gland can also increase your risk factor for osteoporosis. Calcium supplement intake. It's important to protect your bone strength and guard against fractures as you age. But taking a supplement isn't the best way to do that, says Erin Meekhouse, MD, MHS, Associate Director of Preventive Cardiology for Secoron Center for Prevention of Heart Disease. In short, calcium supplements intake may not be helping your bones at all. Even worse, the supplements may lead to major health problems. It is better to take your calcium through diet, much more effective. Women ages 19 to 50 should consume 1000 milligrams of calcium a day. And the target for women over 50 is 1200 milligrams per day. Good dietary sources of calcium include almonds, oranges, dried figs, soybeans, garbanzo, white and pinto beans, low-fat dairy such as milk and yogurt, leafy green vegetables such as kale and spinach, exercise to strengthen bones. Being active and exercising on a regular basis protects bone health. Weight-bearing exercises such as walking, jogging, and weight training are especially helpful in preventing bone loss. Doctors prescribe alendronate, sodium, and cholecalciferol by the trade name Fosamax. Fosamax Plus is used for the treatment of osteoporosis in select patients where vitamin D supplementation is recommended. Bone is a living, growing tissue. Throughout life, our bodies are breaking down old bone and rebuilding new bone in a continuous cycle. Fosamax helps prevent the loss of bone but actually helps to rebuild bone and makes bone less likely to fracture. Side effects of these drugs are aching muscles, joints, and bones. Should we take vitamin D to prevent osteoporosis? Vitamin D is just as important for keeping bones strong and preventing the bone disease osteoporosis. Vitamin D helps your intestines absorb calcium from the food you eat. The dose of vitamin D in the management of osteoporosis should be no less than 700 to 800 international units per day. If your doctor suspects you have osteoporosis, he will order a bone density test. This measures how strong your bones are. Hope this video article was helpful, especially to those women who have reached menopause. Stay safe until we meet again. Goodbye for now.